now, so we'll get going. Welcome everyone to our webinar, Ethical Practice in Public Involvement and Engagement. My name is Kasia Koroska. I'm the Public and Community Partnership Manager for the NIHR Specialist Centre for Public Health, who are hosting this webinar. I'm extremely excited to say that we've been joined today by Dr. Felicity Shenton, who I'm going to introduce in a minute. But before I do that, can I just go through a little bit of a few housekeeping reminders to everyone, especially with we're expecting, we had around 250 people registered for the webinar, and we're expecting at least over 100 to join us. So if just to make you aware that we're recording the session today, so please keep your microphones off when you're not speaking and during the presentation. Feel free to keep your camera on, but if you'd like to, you can keep your camera off. The presentation today, Fiz is going to be presenting for about 20 minutes, and then there's going to be plenty of time for questions and discussions after Fiz has told us what she's going to tell us. If you're asking a question, please feel free to put your digital hand up so we can see that you want to ask a question, and ideally if you could put your camera on so we can see who's speaking, that would be great. Also, we are happy for you to put questions and comments in the chat, and we will try and keep an eye on that as well. And for today will be sent to everyone that's registered for the webinar, and we will also, as we're recording this, we will send the recording. We will make the recording available on our intranet. So without further ado, I'd like to introduce our special speaker today. Dr. Felicity Shenton is the Public Involvement Community Engagement Manager for the NIHR Applied Research Collaboration, the ARC, in the Northeast and North Cumbria. She has a background in children's human rights, participatory research, peer research, co-production, service user involvement in education, research and service improvement. Felicity has worked in the public and voluntary community and social enterprise sector and has a long-standing commitment to ensuring that the voices of those most excluded and alienated are heard and that they have real, meaningful impact. I'm also very, very happy to say that Fiz is a colleague whose support I've been able to work with the last couple of years and has a wealth of experience to share with us today. Fiz is retiring in a couple of weeks, should be saying, so we will be wishing her well for the next stage of what she's going to get up to in her adventures. But without further ado, Fiz, I'll pass over to you.
Thank you very much, Kasia, and good morning to everybody. It's amazing to see so many people here. This is obviously something that is of huge interest to people working within health and social care research. So I'm really happy to be here. And it's one of the last few presentations that I'm going to deliver before I go at the end of this month, so I'm really happy to be here. I'm going to just make sure my slides are moving on. There we go. Right. I'm going to talk to you about the work that we developed here in the North East and North Cumbria, the co-production work that we did that led to the development of guidance, and I will talk about some of the other work that's going on in nationally, and give you a link to some of the events that are happening. So this work started back in the sort of back end of 2022-23, when a member of the ARC's Public Advisory Network raised some questions about ethical practice and ethical approval. At our conference, we have a very lively, active Public Advisory Network, and members are involved in a whole range of governance structures and activities, events and so on in the region. So it was Sandra that kind of kicked this work off. We developed a working group which included researchers, public involvement, specialists, people like Kasia and others from the region, members of the public, voluntary sector organisations, and we started to discuss issues around what is good ethical practice, what is the difference between formal ethical approval and just operating and delivering research that is based on good ethical practice. What does that mean? What does that look like? We then developed a small editorial team that looked in detail at the draft guidance that we'd produced. We were very keen to produce something that was useful and manageable and not something that was the size of a telephone directory that nobody was actually going to use. We delivered the guidance, we had a launch event. At the same time as this, some colleagues in the region were producing a paper which is called Do We Need an Ethical Anchor? And that has led then to contribute to some of the work that is going on in the country to look at the UK standards for public involvement and whether or not there's a need to amend those to include issues around ethical practice. So I'll talk to you in more detail about all of those things, and there are links at the end of this presentation to the practice guidance and some of the papers, as well as the forthcoming event that is taking place at the end of September. So this was Sandra, a long-standing member of the Public Advisory Network in this region. I won't read it in detail, but what she was basically saying was if we're going to work with service users, patients, members of public, experts by experience, as equal partners in research, but we then have to make sure that any activity that we do with them goes through formal ethical approval, needs to be put through an ethics committee, then we're really putting them in a different place. We're treating them as others rather than as equal partners. And she just raised that as a query. Why are we doing that? Is there a need for that? And does that actually, is that in keeping with true co-production? Currently, the guidance from NIHR is that PPI activity does not need specific ethical approval from a university research ethics committee. But the guidance does say that researchers should consider the ethical implications of their activities and include a PPI plan in their formal ethical application to their university or their research institution. I think that's quite clear guidance. It does say that we need to consider the activities, any kind of implications for individual members of the public, voluntary sector organisations, but that there isn't a need for specific ethical approval for PPI activity. In the guidance, we covered a whole range of areas of practice, and they were areas of practice that were put forward by members of the working group. And obviously those people all come at this from a very different place. Researchers have their own considerations, their own perspectives, people who are service users, members of the public, experts by experience, brought their own issues, their experiences being involved in research and some of the concerns that they had about where things had gone wrong in research that they've been involved in. And over a period of about 18 months, we agreed the main topics that we would cover in the guidance, and that's a list of them there. And I think they probably cover all of the important areas of practice that you need to think about if you are delivering health research in partnership if you're co-producing research. The guidance document, as I say, you will get access to that, is structured in a particular way. So there's an overview of the key aspects to consider, and the suggestion is that you go kind of quite formally through all of these things when you're working at the start of your research, when you have your research advisory group or your project team, that you think in detail about each of these particular areas. The guidance then offers more detailed outlines with links to some of the other really useful guidance resources, toolkits, papers and so on. There's a glossary of key terms because that's not necessarily always understood by everybody that gets involved in a research project. And that was again something that particularly practitioners from the voluntary sector as well as public members asked for, was a kind of overview of the key terms, so everybody's using the same language or understands the same language when they're working together. An overview of the research cycle, and then really importantly we were asked for a checklist that people could use as a really kind of quick guide to, yes, we've covered these things, no, we haven't thought about these things. So that's the structure of the guidance document. And this just gives you an example. So on one of the areas, which is working in challenging and sensitive areas of research, the checklist asks you, have you considered whether topics might be triggering or difficult for members of the public and researchers? It's really important to think about, if you're working in challenging and sensitive areas of work, this might be difficult for the public members, but it might also be difficult for some of the researchers. So Have you thought about the kind of safety, the welfare, excuse me, the needs of both public members but also of researchers? Have you built in time for breaks and reflection, for making sure people are properly prepared, as well as debriefing after activities, research meetings, etc. And then we were asked for making sure that there were contacts or links to organisations that could provide support. So if you're working in an area such as childhood trauma or domestic abuse, have you given people information about support that might be available in the area that they're working in or living in? Have you given them voluntary sector organisations or national organisations that provide support so that they can access additional advice if needed? This very busy slide is, which I don't expect you to be able to read, but that gives you an overview of the checklist. So it gives you these are the main areas that we think you should cover when you're considering how to operate in an ethical manner. And then a couple of kind of pointers about things that you might want to consider. And people have found that very useful. It's been piloted a couple of times in the region, and people have found that a very useful kind of quick way to think about, have we talked about all of those areas with our research team? Have we put information in our formal research approval application? And have we got some kind of written guidance, written agreement? It might be terms of reference for our public partners and any other research partners that they're working with. So that is a handy, quick sort of framework for considering the issues that you might want to have an overview of before you start your research. So alongside that piece of work, as I say, it was launched in 2023. It's been piloted. People have found it obviously very useful. As ever with any practice guidance, they're out of date the minute they're produced. So it's a piece of work that will need to be continually updated. And as new research papers are published, where there's new guidance being issued, either nationally or by other research infrastructure organisations, those links in the guidance document will need to be updated. People should feel free to use the guidance in any way that you find useful. All of this work is funded by the NIHR. It's public money, it's public resources. So if you find the document useful but you want to customise it for your own organisation or your own team, we're very happy that people do that. So at the same time as this work was going on to co-produce the practice guidance, colleagues from the region, some from the ARC, some from the Research Support Service, and all members of the PPI regional network called Creating Connections, were in the process of preparing a paper which has been published. And they were considering the question, do we need an ethical anchor? Is there something that we need to develop that kind of ties down what ethical practice is, what's good ethical practice, what does treating people in an ethical manner actually mean? So Sophie Suri and colleagues had this paper published, and I'm just going to go through some of the main areas that they put forward in this paper. And again, you can read that in more detail at your leisure. So they talked about emotional risk, the potential of triggering, re-traumatizing people by asking them to share their lived experience. Again, particularly when you're talking about very sensitive areas of research, childhood trauma, domestic abuse, serious mental illness, people who are living in marginalised communities where they are at risk. So the current kind of really hostile environment for refugees and asylum seekers or members of the community who are trans. If you're asking those people to be involved in research, by asking them to reshare their lived experience, you may be traumatising or re-traumatising those people. And there is a risk then to their own health and well-being, including researchers. We all come to this work with our own history, our own experience, our own use of services, and you need to think about the impact that hearing people's stories, hearing people's experience might have on the researchers and the research team, as well as on members of the public. And then people who become ill, or one researcher who had the awful experience of one of their PPI members dying during the research process. And it sounds a bit sort of way off that you might have to think in advance about what if that happens. But people do experience, life happens to people when they're involved in research, particularly when you're talking about long pieces of research, 3 or 5 years funding. What do you do when members of the public or members of the research team pass away during the process, become ill during the process? We had one member of the ARC Public Advisory Network who, at times during her involvement with us, was unwell and in a secure mental health facility. And we made it possible for her to continue to take part in meetings where that was safe for her and possible for her, with all of the right protections and all of the right support available. So it's worth thinking about what happens when people become unwell during the process, and what you do to properly support them, and what the difference is between you being a good colleague and being a clinician or a practitioner, because they're not the same thing. Physical risk, you need to think about where you hold meetings, where you hold events. My advice would always be that you should hold events in a public space, so libraries, community centres, leisure centres, hotels, community centres, places where they are fully accessible, where you have proper public liability insurance, where you have people on site who are first aid trained, that you've thought really carefully about the environment in which meetings are being held, and somewhere that is familiar to, accessible to, inclusive of members of the public, and do that in discussion with them, so that you've thought with whoever's part of your team about the place that they would feel most secure and safe and accessible. Issues about research conducted, PPI activities conducted where a researcher is on their own. Most organisations have a lone worker policy. It's worth looking at what the implications of that might be. Quite often researchers are going out to community organisations, community venues, maybe at weekends or in the evening, or they're going on their own. Have you got some system of making sure that the researchers are properly protected and that their welfare is being considered? Risks of working with children, young people, or vulnerable adults where there is the risk of exploitation. Have you thought about issues like DBS clearance? You would be amazed at how many researchers don't have DBS clearance, and when you ask them and they request that from their universities, sometimes their universities say, well, you don't need that, we've got nobody else within the institution has DBS clearance. But you do need to think, particularly in the current climate of exploitation and the negative impact of social media, you do need to think about some of the risks involved in working with vulnerable groups and the risk of exploitation. If you are, for example, paying people and you're taking cash with you to a venue to give people, or you're taking shopping vouchers, you need to think about whether that's safe for you, but also for the members of the public that you're working with. And the risks, and again, this was the feedback from a particular researcher that was involved in some very creative, innovative physical activities as part of the PPI sessions, where a member of the public had an accident and needed to get to hospital. So not for everybody in certain circumstances, but you do need to think about whether there are additional risks. And I know, because I've just done it, that completing your institution's risk assessment is not for the faint-hearted and does take quite a bit of time. So you need to think about whether that is something that your institution will require. Confidentiality and personal data, again, might sound obvious, but when you're working truly with a co-producing a piece of work, you might have an agreement as the researcher or as the person that holds the research funding that you need proper consent, informed consent from anybody when you are taking photographs or films or videos of people. But you need to think about what happens if other people within that group, members of the public, local community organisations, people use their phones, can take pictures really quickly, perhaps without anybody noticing, and they might be doing it with the very best of intention to put on their website to put on put in their annual report, but you do need to think very carefully about needing proper consent and having an agreement with the group about when it's okay to take photographs and when it isn't, and when it's okay for members of the group to say they don't want their photograph to be used. And there's lots of very good safeguarding reasons why some people don't want photographs taken. Having an agreement about how to phrase direct quotes from members of the public or community organisations when you're presenting, putting information out on social media, or you are publishing. Quite often, if you quote directly from PPI members or your research participants, and you'll lift a quote from somebody that's it says exactly what it is you want to portray in your research, and you ask permission, is it all right to quote you in this? And people say, yes, it's fine, and please use my real name because I'm happy to own what I said. In a very small community, in a particular area of research, if you're working around young people who've got into trouble with the law, for example, and you're using their names, even their first name, you might not be using their full name, and you quote them in a piece of work that then comes back to that community, it's not difficult sometimes to identify who those individuals are. So you need to think really carefully about how you use people's own words and their own narrative when you are publishing or presenting work. And as this says, some members of the public are put in danger if their identity is leaked outside of a group setting. So you need to think very carefully as the researcher, but also how you have an agreement with other members of the group who may also be local community members, and they might inadvertently share information about people's identity, and they're not doing it maliciously, they're not doing it in a way to cause problems, but it can, if the names get out, it can create huge difficulties. And again, I'm thinking of the current climate with asylum seekers or certain members of marginalised communities whose identity can be really precarious in some certain situations. So anonymity, you might think it's an easy thing to do. We agree that everybody is going to remain anonymous, but in certain populations, in certain circumstances, that becomes quite difficult. And what you don't want is to suddenly have to have a conversation about that once it's become a problem. So when you're thinking ahead, you're developing a working agreement with members of the public in your PPI group, have a conversation with them about what confidentiality actually means, what anonymity actually means, what the boundaries are to those things, and ensure that you have some kind of agreement with all of the individuals involved about what that means and what the boundaries are. Sometimes it's really difficult to get the balance right between support and paternalism. Sometimes when you're trying to do something that protects people's identity, protects people's information, protects their stories, actually what you're doing is disempowering those members of the public from saying what they want to say, from sharing their experiences, sometimes very negative experiences of particular services or particular treatments. And they sometimes it's very cathartic for individuals to share their version of events, what happened to them. And if you prevent that from happening with the very best of intention, because you're trying to create a safe environment and you don't want people to overshare, you don't want people to cause additional difficulties for people, actually what you're doing is disempowering people, or you're reinforcing the power imbalance. So you have to think really carefully about issues around power imbalance, issues around you as a researcher or you as a practitioner. You do represent the authorities and you are in a position where you can exert power, maybe unwittingly. You don't intend to do that, but by you making lots of the decisions in advance about what people can say, where they can say it, how they can say it, how that gets passed on through presentations or through written material, if you create circumstances in which you make all the decisions about what people can share and how they can share it, you're reinforcing existing power imbalances. So think really carefully and talk to your PPI group about this. have a shared discussion at the outset about power and the power imbalance that exists between members of that group in advance. And again, don't wait for things to get out of hand before you have that conversation. Marginalisation, again, the risk of perpetuating harm and reinforcing oppression. When you're working with members of marginalised communities, sometimes what you're doing is actually perpetuating further harm and reinforcing the institutionalised exclusion that people face, and you might be doing it without thinking, without really considering the processes. But talk to people about how they are currently excluded and marginalised within their own communities, and try to make sure that the research they're involved in doesn't make that worse. The whole kind of ethos of ethical behaviour, ethical practice, is about doing no harm. So in your research, make sure that you're not doing something that inadvertently makes things worse for people. Building and maintaining healthy relationships, personal professional boundaries with PPI members. This is complicated stuff. Sometimes if you're working with members of the public over a long period of time, you do get close to people. You do see people who come from the same kind of value base as you do, and you have decisions to make about whether those people are close colleagues, whether they become friends, what the relationship is and what it isn't, whether you should share things like your personal mobile, if you've got a personal mobile. I know a lot of researchers don't have work mobiles, but should you share your own personal contact details with people? What is the boundary between your personal support to people who are living in sometimes very difficult circumstances, and what are professional boundaries? If people are really struggling with issues around serious health issues, any kind of contact with law enforcement, if you're hearing things that you think make somebody unsafe, or you're hearing things about potentially criminal behaviour, what are your responsibilities for sharing that information? What are you duty bound to share, and what should you just keep to yourself? And you need to have a conversation with people. If you're working with children, young people and vulnerable adults, there will be safeguarding policies and procedures within your own institution. If you're working with children and young people and you hear information that you believe makes that young person unsafe, immediately unsafe, or other members of the public unsafe, your institution's safeguarding procedures might be that you have the responsibility to report that. You might have a safeguarding lead within your organisation, or you might be required to either contact the police or the local authority. And that's true for vulnerable adults as well as for children and young people. So if you're working with people around things like serious mental health issues, where you're concerned about somebody's behaviour, you feel that they might be at risk of harm, what do you do about that? Who should you tell about that? What are your responsibilities as an individual, but also as a professional in that circumstance? And what are your responsibilities in terms of informed consent from those individuals? If you feel that you need to contact the local authority or the police, make sure that you do that wherever possible with the full knowledge and consent of the individual. Don't do things behind people's backs. So think about your personal and professional boundaries, your responsibilities, and have discussions with members of your PPI group about their expectations of each other and of you. Poor communication about research outcomes. The two biggest complaints that I've heard over the last 5.5 years of doing this job from members of the public and community organisations are firstly about remuneration, whole different session. I'm not going to get into that now. There is work going on in this region and nationally about trying to address some of those challenges. But the second biggest criticism I hear is from members of the public or community organisations who say, we got involved in a piece of research, the researcher came, we took part in helping to develop some documents, develop some research strategies, some recruitment strategies. We took part in PPI groups, or the researcher came and we were members of focus groups, or we completed a survey, we completed interviews. Researchers vanished off the face of the earth and we've never heard from them again. We don't know what happened to the information we shared. We don't know what happened to our really important story, our narrative about what happened to us. We don't know what attempts were made by the researcher to use that information to improve services, to have conversations with the local authority, to approach the Home Office, to talk to the Integrated Care Board. What did they do with that research evidence, and what attempt did they make to improve the circumstances that we were talking to them about? It's incredibly disrespectful, and it's very poor practice for researchers not to come back and talk to individual members of the public or community organisations and to let them know what happened at the end of that piece of research. Where did it go? How was it disseminated? What attempts were there for it to make a difference? We all know from having been involved in this work that we can't change the world. We would all like to be able to improve services for marginalised communities. We would all like to address inequality and poverty, and sometimes that just isn't possible. Nevertheless, it's really important that people who've been involved in research know what happened to that information and know what attempts you've made as a researcher to address the issues that have been raised with you. So go back and talk to communities, send them information. They may not necessarily be interested in your published reports, but they will be interested if you send them a plain English summary, or you go and have a presentation at the end of the project about the piece of work. So if you don't do that, what you do is you jeopardise the opportunities for future researchers to go back and talk to those communities again. If you've had a really poor experience of research and a new researcher comes along and says, I really want to do a piece of work in this area, you're very unlikely to say, yes, we want to be involved in that, because you've had poor experiences in the past. And the final point is about withdrawing at the end of the project. And again, I've had a number of researchers, but also public contributors who saying, I didn't know what to do at the end, because I'd had this group of people we got really close relationships with over a 2-year, 3-year, 5-year piece of work. How do you draw that to a close? What are your responsibilities for keeping in touch with people? If you decide that you've developed a friendship, or you developed kind of an ongoing relationship with people, make that clear, have a conversation about what happens at the end of a project, and don't wait until it goes wrong. So those are some of the issues addressed in that paper. There's some of the issues addressed in the practice guidance that has been produced. There are links to both of those at the on that presentation. Two other things. On the 25th of September, there is an online webinar that is being delivered by myself, members of the ARC East of England, Ange Broadbridge from Ways to Wellness, which is a regional voluntary sector organisation, and the Health Research Authority, that is exploring some of the issues around ethical practice, but also about whether or not we need to start to think about the current UK standards for public involvement. And they are the kind of standards, the values and principles that all good PPI is embedded on, and whether there are sufficient links within the current standards to cover areas of ethical practice. So that's part of an ongoing piece of work which the HRA, Health Research Authority, is leading on. And that event on the 25th of September, it's an online event. There will be BSL interpreters present. At the moment, you can still register for that. And I think Kash is going to put the link in the chat. We have unlimited audience, so if you haven't registered, there's still plenty of time. And you can then be part of an ongoing conversation about your concerns, your issues about ethical practice, and some of the worrying trends that we're encountering where universities are beginning to ask for formal ethical approval even for PPI activity. And it would be great to have a conversation nationally about people's experiences of that and whether it's hindering good co-production. So I think that is me, and I will stop sharing, and I'm really happy to answer questions.
Thank you so much, Fizz. And you've left us lots of time as well to have any questions or comments. We've got one ask in the chat for a link to the PDF. I'm going to assume that's to the article as well, Fizz, if we can, or Nicola, Nicola or Ellie, if you can find the link and share it, that would be awesome. Has anyone got any questions or comments for Fiz? Doreen, go for it.
Thank you. That was a really great presentation and also a refresher for some things I've forgotten. So thank you very much for that really insightful presentation. I'm asking a question about a live project, actually. I'm currently dealing with young people who are vulnerable because of their experience of a condition. What are your thoughts about when PPIE crosses over into research and when you then would need institutional approvals for ethics? Because some of the points that you raised are very ethics oriented. So I was just wondering about what is the cutoff? And one of your slides did have something around ethical considerations, but at what point should somebody carrying out a PPIE activity that has actual research elements in such as surveys and focus groups think about applying for formal ethics?
Okay, it's a really good question, and I think there is a real grey area, isn't there, about what constitutes PPI activity and what constitutes qualitative research, and a real tension, because what you want from a PPI group is for them to impact on your thinking about your research, the way you conduct your research and your research findings. So you are inevitably going to use the information that those young people talk to you about, give you in your discussions, to help shape the way that the research is being delivered. So it inevitably is kind of research findings because it's shaping the way that your research is conducted. I think if you are doing surveys or you're having focus groups with your PPI group, I would call that research, qualitative research, and I think you do need ethical approval for that. I think if you are lots of journals will not publish evidence even from PPI without you getting ethical approval. There's a whole other debate about whether that's the right thing or not. But I think if you are obtaining information about those young people's experiences in a more formalised way, so through a focus group or through surveys or interviews, I think that is research evidence. I think if you're having conversations with those young people about, or using creative methods with those young people to elicit information about how they think about the issue, I don't think that needs formal ethical approval. It is a bit of a grey area. There is a document on the NIHR website somewhere, I think, which gives a distinction between qualitative research and PPI. I think it's a grey area. My advice in all those situations would be to talk to the young people and to get an agreement that is a working agreement just for your research about what they think the difference might be, and go forward from that.
That's really useful. Yeah, no, that's really useful. Thank you very much.
You're welcome.
Just to add, Fiz, I think a couple of local authorities have tried to create their own kind of decision trees with some of this. I think Bradford HDRC might be one as well. So Doreen, I will follow up with Bradford and just check where they got to with their decision tree. And we also at the centre, we have a whole pillar of governance around governance and research for local authorities. So we could follow that up as well and see if there's anything else. And Fiz, maybe we could try and dig out where the NIHR have got that link, and we could follow that on. Yes,
no problem.
Thank you both.
Thank you. Anyone else got any questions? Feel free to put it in the chat as well if you don't want to kind of take your mic off. Yes, Charlotte will definitely be sharing the documents and the presentations and a recording of this with everyone that's registered. Can I ask you, Fiz, if people are still thinking, you've been involved in this for quite a while now, and looking ahead, and you kind of alluded to this a little bit, but what do you think the main opportunities, but also the main challenges around public and community involvement, and where it strays into ethics or not?
So I think that there is a real tension now with the growing kind of commitment to true co-production and approaches like peer research. There is a fantastic kind of growing movement of researchers who are working in an equal way of co-production and members of the public, where young people are trained as research, people with are trained as peer researchers to do work in their communities. I think that's fantastic. I think it elicits some really great research evidence. Probably isn't accessible using more formal kind of academic methods. But I think with that growing kind of commitment to true co-production comes a tension about at what point is that evidence, does that need formal ethical approval? And what do we do if we've got people who are members of the public, who are the researchers, they are doing research, they're co-researchers, peer researchers, but they're not employed by a university or by an NHS trust, so they don't necessarily have the same responsibilities or commitments as an employee of an institution, research institution. So they're not necessarily tied to the same ethical approval processes within that institution. And I think that there will be a growing tension about the evidence that is created through proper good co-production methods and the need for formal ethical approval. And at the moment they're going in opposite directions. So if universities are saying we need proper ethical approval for everything, including PPI activities, and co-production is going down the line of we are treating everybody within this research team as equal partners, I think that will become a significant issue.
Thanks, Fizz. And obviously a lot of the people joining the call be from local authorities as well, and trying to grapple with where to get ethical approval and what the routes are as well. So even more, hopefully we can help at the centre with the arts as well on that.
Some local authorities have developed in the past their own ethical approval processes, and I think that's a really good thing, because it is different if you're a practitioner within a local authority, not a researcher in a university. There are very different kind of expectations about your relationships with communities and about working with service users and members of the public. And I think some of the local authorities that have developed their own ethical approval processes are beginning to think about what does research done by our own practitioners actually mean. And I think that's good to have those discussions. It's a good way forward.
Fizz, we've got a question in the chat, and then we'll come to Gail. Kirsty's asking, what advice do you have, or what action should be taken if boundaries/agreements that are in place are broken by a member of the group? And Kirsty, is that a member like a public or community contributor, or a member as in a researcher, or both?
More of a member of the public, a member of the community.
Okay. Very tricky. Great question. There are circumstances, certainly that I'm aware of PPI members whose behaviour within groups within a piece of research has become problematic. People have their behaviour or their language is racist, homophobic. People are bullying other members of the PPI group, and their behaviour has become problematic for other members of the group and for the research team. Or, as you say, they've had an agreement perhaps about confidentiality or anonymity, and they've broken that agreement. It's complicated because, as I say, they are members of the public, so they're not employed by an organisation. If you, in your workplace, use racist, homophobic language, or your behaviour is seen to be in some way discriminatory, there are proper HR procedures that would challenge you and your behaviour, and ultimately people lose their jobs if they're using language or behaviour that is deemed to be unprofessional. You're guided by a set of professional standards. For members of the public, they are not required to adhere to those same standards. I think what we're suggesting by having these discussions about ethical behaviour, ethical practice, is you've had an agreement from the outset, which everybody's been part of co-producing. And if in the course of their involvement they break that agreement, I think you're perfectly within your right as the lead PPI person or the lead researcher to have a conversation with that individual to find out if there are particular extenuating reasons for that behaviour or for them to have broken that agreement, to perhaps say, we don't want this to happen again, we want you to carry on being involved in this, we don't want this to happen again. If it happens again, then at that point I would be saying, I don't think your involvement in this group is helpful any longer, and we don't want you to continue to be part of that group. That's the kind of very last thing that you want to do to a member of the public. I think if their behaviour is impacting on other people within the group, or they've broken agreement that jeopardises the safety and welfare of other people within that group, then I do think it is you are within your rights to say that you don't want them to continue to be involved. We have an agreement within the ARC. Again, there aren't formal complaints processes like there are in local authorities. So if I do something in my job with members of the public, or researchers within the ARC do something that somebody wants to complain about, there isn't the same formal process as there is in a local authority or a hospital or an NHS trust. But what we do is to say, talk to me first. If I've done something that somebody's upset with or offended by, talk to me first. If you're not happy with my response, then you should speak to my line manager, who's the Chief Operating Officer. If you're not happy with that response, speak to the ARC Director. So there is a process that you've explained to people in advance. This is what to do if you're unhappy with your treatment within this piece of research, and that ultimately it might result in somebody reprimanding me, or it might be result in that individual being asked to leave the group. So go through a proper process, make sure there's some kind of independent, objective view built into that. But if somebody's behaviour is offensive or it puts other people at risk within the group, then I think they need to be asked not to continue their involvement. I hope that helps, but it can be really difficult.
Thanks, Liz. Well, Gail's patiently had her digital hand up. Gail, over to you.
Hello. Great, thank you for an interesting presentation. My question's around when you mentioned about if a member of your public contributor becomes unwell, and I've had experience sort of a year or so ago where somebody just wasn't getting back in touch with us, and you worry for their health and their safety and if they're okay, and it's what you've done in your past or what other people have done to then the next step for that, because it's like, should we try writing a letter and see if someone will pick that up? And luckily they got back in touch and was okay, but just that real worry around if they're okay, and we don't take all that data and information, next of kin and all these sort of emergency contact. Should we try and do something like that? Is it okay to do that? So it's just what your thoughts are on that.
Okay, yeah, good question. I think if you're working with children, young people or vulnerable adults, I do take emergency contact details, and if they're coming to meetings in person, then I would have any kind of access issues, communication issues or medical requirements recorded. I think for other members of the public, then you don't have those details. You're not involved in their lives as a practitioner or as a clinician, so you're not their social worker, you're not their community nurse, you're not their therapist, but you do have a responsibility and a duty of care to those people. So I would certainly be ringing them, writing to them, perhaps going and knocking on the door if it's someone that you know, how are you doing? I haven't heard from you.
They're the other end of the country.
Don't knock on their door, but certainly I would be trying to make contact if you know somebody else that also knows them. So if you've got a kind of another PPI member that you know they're close to or that they come to meetings with, you could just say, have you heard from Joe? Haven't heard from them a while. Ultimately, there's not much you can do. I certainly would be writing and saying, haven't heard from you for ages. Are you okay? Is there anything I can do? Please do get in touch. You're always welcome to come back to the group. People do go off the radar. People, certainly there are people who've kind of just gone to ground for a little while because of their own personal circumstances or health issues. And I always make it clear to people that they can come back at any point. I hope that helps.
Yeah, thank you.
Okay, we had a couple of questions in the chat. There was one around hard to reach groups from Nicola, hard to reach groups, so groups where researchers need to try harder to reach them. Talking about local authorities maybe in really rural areas and wanting to engage with community members, vulnerable groups who maybe have digital poverty, bad transport links. How can a local authority co-design, co-produce when the financial envelope is tight to be able to support lots of people getting online or physically to events? We seem to be making the mistake of doing kind of world cafes big in the busiest towns, and it's the same voices. So kind of a question around that. Yeah, how do we get to those voices, particularly with a local authority lens?
Yeah. My personal view is that there's no such thing as a hard to reach community. There are communities that are never listened to, and opportunities for their involvement is always restricted by cost, broadband, people not putting themselves in the position of those communities and going to them. So I think that if you're doing research, there is always research funding that is built in for access, inclusion, PPI. Don't expect people to come to you. Don't expect people to come to University World Cafe sessions, or I do lots of work over in West Cumbria where the public transport is almost non-existent, or there's kind of one bus a day that goes at 9 o'clock and comes back at 4 o'clock, where broadband is very poor, where people are living in absolute poverty and can't afford to travel somewhere else for a meeting. For me, you go to them, there will be a local parish hall, community centre, doctor's surgery, library, some facility that is open, accessible to the public. Go to them and ask for a space in those buildings, or to tag on to an event. So people are having knit and natter groups, or yoga groups for older people, or language support services in community centres for people for whom English isn't their first language. Ask if you can go along to that session, and then maybe have an hour after the session to continue to work with those people. I think sometimes there is a kind of idea that we've done as much as we can by having interpreters present, putting information out in different languages, paying for people's travel and transport. Sometimes researchers need to go to communities and not expect people to come to you. Some colleagues of mine, public contributors, ran a session recently, which was they called "Hard to Reach, How Hard Are You Trying?" And I think the onus is on the researchers to try harder.
I'll just do a quick plug as well, Nicola. We have the Specialist Centre is launching a funding award on the 29th of September. It's a public and community partnership award of up to £10,000 for local authorities that are not HDRCs to be able to develop their connections with communities. So Nicola, watch out for that. Join the mailing list if you haven't already. And if you're in a non-HDRC local authority, then it could be something you could use to do something on that. There is another question around, are there any ethical implications around representation considering limited funding for remuneration? What's your advice on how to balance creating inclusive, diverse spaces and conversations without being tokenistic with people with protected characteristics? Is there a distinction between research and PPI? We've got 5 minutes, Fizz, go for it. For that question.
Really good question. I have a massive issue with researchers approaching voluntary sector organisations as a proxy for members of the public. So, and increasingly for the ARCs, we're being asked to consider research that is done kind of regional to national rather than very local. And there is a tendency then to go to some of the big voluntary sector organisations, Barnardo's or AIDS UK, Parkinson's UK, as a proxy for talking to members of the public who are diabetic or have Parkinson's or have been involved in the care system. I think that people should, wherever possible, be working with individual members of the public with real lived experience of those services or those conditions, and not be working at a broader level with people who are deemed to represent the views of individual people, refugees and asylum seekers, or the trans community, for example. Talk to people within those communities, and it takes time and it takes building trust, and certainly do that through the voluntary community sector organisations who do have the trusted, long-standing relationships in those communities. But I think asking those people to represent the views is really problematic. Somebody said to me, you know, they represent the views of all women in the northeast of England. You think, don't represent my views, never heard of you. So wherever possible, talk to those people where, you know, individually, personally.
It's fine. I've only got 3 minutes left. Regarding the award, would applications that had support from existing HDRCs? Yes, we are very much. We can't. The Specialist Centre can't give money to HDRCs, but we will be looking for HDRCs to partner with other local authorities. I'm going to share the latest bulletin that we sent out this week in the chat, so you can see there's information about that funding award that's coming up there. I think with 2 minutes to go, we'll leave it there though. Thank you so much, Felicity, for all of your expertise, for sharing so kindly with us, for giving some advice to our colleagues on the call. We are wishing you very much the best of luck for your next adventures, and please keep in touch. We will, like, just to say, we'll be sending out the links, and if anyone would like to just follow up with the centre, with Nicola, Ellie, Fiz or I as well, and enjoy the rest of your day. Thank you very much, everyone.
Thank you.
Thank you.
Thanks, bye.